Hello, everybody. This is Dr. Ganesh Lakshman here again with you on the website chat of Healthy Business Insights. Wonderful to be with you again. Today, we have with us a very, very great personality from cancer care, Dr. Indu Bansal, who's the Group Director and HOD at Paras Hospitals. She heads the entire oncocare radiation department there. And she's been a very, very passionate doctor, I would say, care about the cancer patients. And instead of me talking about her, I would rather urge her to, say something more about herself. Then we can, move towards the discussing on her insights on the business. Yeah, Dr. Indu, let me start by welcoming you first. Thank you so much for accepting the invite from us. It's wonderful to have you here. Cancer is a very, very passionate subject for us, and we definitely want to do a lot of work around cancer, not just in India, but globally. So first of all, thank you so much, and welcome once again. So Dr. Indu, I would like to start first I would want to take one small point of yours where we came across that you are a very, very passionate writer. You write poems and all. So, to set the momentum.
Good evening, everyone, and to everyone who is watching this episode of Health Business Insights. And I am feeling really privileged and honored to be invited on this platform to share something about cancer. And I've been in radiation oncology for now close to 28 years. And as you said, that this is something which I really love. So that is why, I try to impart knowledge about cancer in whatever way possible. So as I said, I write at times and I do some poetry and I do paint also. So through these mediums also, I try to communicate something about cancer. So I've written few poems in Hindi to create awareness about symptoms of cancer, and I've written few poems to explain about the feelings of cancer patients. And I've also made some paintings to depict about cancer as such. So that's why I would say that the only quote that I would like to say here is that cancer cannot take away your spirit. Cancer cannot take away your zeal. It cannot take away your family from you. So you have to be, I would say that everyone who is dealing with cancer, the caregivers also, they also need a lot of care. And the caregivers also need a lot of care. And they are basically the ones because of whom we are able to take care of the cancer patients. So they are a bridge between us and the patient. And they need a lot of hand holding apart from the cancer patients. So this has been my motto, to look after not just the patient, but the caregiver as well. So with this, I would like to start and proceed further.
Lovely. You have absolutely rightly pointed out a very, very important point, which I've always been speaking about, and that is of the caregivers. While everybody speaks about the patient, but the emotional and the financial trauma which a caregiver goes through is really painful. So it's very, very important today to give a mental support, mental health, mental well-being for the caregiver and not just for the patient. You're absolutely right. So to start with, I just want to understand what are the three most important, business principles which you have adhered to for cancer care within your life, not just in Paras or anywhere. What has been the three most principles which you think are coming foremost for you?
So one is the most important thing that I feel is do the right thing. Don't do just for the sake of money. Do the right thing which the patient needs. Number one. Number two, there should be a very honest communication about the disease, about the treatment outcomes, about the cost involved, and the care of treatment. And the third most important principle that I feel is very important is empathy and compassion. because without that, you cannot treat any cancer patient. So the three principles that I've focused always on is do the right thing in the first place, have a very honest communication, and number three, utmost empathy and compassion for the patient and the caregivers.
Absolutely, I completely agree to you. Also, how have you managed to, provide, equal quality and care to patients across, in your uh, career of working for various hospitals? How have you managed to do the two things?
One is that whenever a patient walks in the OPD, this is the patient matters, not his financial background. So I think this is my principle that, as I said, the first principle is do the right thing in the first place. So if I rather feel in the sense that if any poor patient walks in my OPD, that patient deserves more of my time, attention, and explanation and care, because that patient has made a lot of effort to walk in a big corporate hospital. So they might have spent hundreds of thousands of rupees to sell their house or to sell their cow or to do any such thing to even think of coming to a big hospital. And from my experience, what I've seen is that these patients, they are the most loyal patients. They stick to you. They don't do window shopping. And if you guide them properly, then at least they are able to save their patients. So, as I said, I first think there are two things whenever any patient walks to me. One is, can I cure this patient? If I can cure this patient, then my maximum effort would be curing that patient. So then I tell them that this is what is needed for your patient. This is what is going to cost in this hospital, and this would be the total cost of treatment. If you can take it here, then it's okay. If you can't, then I can connect you to my colleagues who are in other corporate setups, or I can connect you to some NGOs which might be able to help you. So number one is this, that give them the right guidance. That is the most important criteria. Number two is that if you tell the facts honestly and don't think that because he can afford, so I will offer him the more costlier treatment. That's not my way of working. I always believe that I have to tell the right treatment, give them the options, and then tell them that if you take this treatment, it's going to help you or it's not going to help you. So if I can cure the patient, then I tell them that even if you sell your house or something, it's okay, because at least your patient would be alive. But if you cannot cure the patient, then is my treatment going to improve the quality of life of the patient?
Yes.
If neither of these two objectives are achieved, then I tell them that if you take the treatment, it might prolong the life by a few months. So you can go for this treatment or you cannot go for this treatment. So I think improving the length of life, but that length of life should be worth living. That is very, very important for me. So I may cure a patient, but leave him with a very bad side effect. So the patient will keep on spending a lot of money just on managing that complication. So that is why my lot of emphasis is not just on cure, but a lot of emphasis on the quality of life. And second thing is that they should not stop living with the diagnosis of cancer. Diagnosis of cancer is the beginning of a new type of life. It's not the end of life. So you can still paint, you can still cook, you can still go shopping, you can still do horse riding, whatever you want. So my objective is that they should go back to their normal life after the treatment. So equality of care is, as I said, is important. So if you're doing the right thing, then it doesn't matter whether you're dealing with a rich patient or you're dealing with a poor patient. But of course, at times we do come across situations when a poor patient cannot afford any treatment. So we take special permission from the corporate hospitals and from the management. Until now, nobody has refused me from lowering the cost of treatment for a curable patient. So I've been lucky that I've had very good organizations and very good management people who have always supported me whenever I've tried to help any patient. So I'm blessed that way.
It's very good to hear that corporates are supporting cancer today. And it's not just hospitals, but also across others corporates also, whenever I speak to them, there is a sort of a weak point for when it comes to cancer, because when you speak to people, uh, for sure they have definitely come across somebody within the circle who's gone through cancer. Anybody whom you meet has gone, somebody in the circle who's gone through cancer, so they understand the disease and understand the pain and the problems. So I think the awareness is also very important. And so when I'm talking about awareness, you're doing the absolutely right thing by showing the compassion and showing the care, and also showing the right path to the patient and the caregiver, which is very, very important. Not giving any false claims, false this, so which is very important. So I think you've done a fantastic job there. So I really appreciate you for that. That's absolutely wonderful, amazing. I think everybody should take a cue from that and probably follow what you're practicing right now. Also, moving forward, I would like to understand, having been in cancer for a very long time, treating patients and all, what is your view in terms of the quality of cancer care, and where are we heading globally for cancer? I mean, with the new technologies coming, so AI coming, ML coming, there are companies which are there who are able to, provide early detection and everything. But still, they're all in a very early stage. They're not able to penetrate deep into Indian markets or in rural areas. So all those problems still exist. So what are your views? I just want to rather hear from you. What are your views, and how do you think we should be able to tackle these problems?
So I would say that since I started my journey in oncology since 1996, till now, I would say that we have come a long way. And definitely because of technological advances, I think India is not at all far behind the Western countries. So whatever treatment is being done in the best of hospitals across the world, I think I can very proudly say that we are able to deliver that treatment in most of the centers. And one good thing that has happened is recently, in last 4 or 5 years, there has been a mushrooming of cancer centers, even in 2-tier and 3-tier cities. So before COVID, we would see a lot of patients traveling from far off places in India to take treatment in Delhi and Gurgaon. But now, because most of the centers, most of the small cities also have at least one radiation unit, so now patients are able to get a good quality treatment even closer to their home. So this is something which is good that I would say. And second thing, we have so many international patients who are traveling to India to take treatment, and a lot of research is being done now in India on cancer patients, and we have the best of technologies. And I would say that in fact, I would say that we are much more cost effective.
Yeah.
And the quality of care that Indian doctors are providing now in terms of cancer is phenomenal. It's not less than any other place. In fact, because the patient volumes that we see in India is much, much, much more than the best of centers in the world. So I think the plethora of patients that we see, uh, so then it's very easy to now treat patients, and knowledge sharing all across centers in India is happening a lot. Our Indian doctors are speaking on international platforms, and we are coming out with Indian guidelines, so which are being adopted by Western people also.
Wow.
And I think one more thing that has changed is because of this thing, teleconsultation. So now we are able to reach even the remote areas. So because everyone has a smartphone, they just have to call us on our WhatsApp, and they share their reports with us. We tell them that this is the treatment that would be needed, and this much stay that would be needed for you to come here. So that's why they are able to plan out treatments, and we try to minimize their visits as much as possible to our places. And at times, because we have connects with other doctors in other countries, we do share their reports. If we come across any such patient which needs a very special thing, then we connect with them. The molecular genetics is now advancing, so we are now able to provide personalized treatment to these patients. And most of the drugs which were not available in India now, they are being imported. We have people who help us in importing the drugs. And because of the facility of ECHS, then CGHS, ESI, because of these government schemes and Ayushman Bharat, many of the patients and many government schemes which are happening in different states, many people who could earlier not afford treatment, they are able to take treatment. So I would say that a lot of things have happened in terms of cancer care. More and more patients are living longer. More and more patients are being diagnosed in a pre-cancerous state. And the quality of life of course, the patients is improving. So that's a good change.
So in terms of change, I think the last point, which is the quality of life which they're living, is I would rate that as a more important than anything else, because once a person in a family gets affected of cancer, the entire family is affected. It's not just the patient; it's the entire family. So I think more important is the quality of life. So as you rightly said, the life goes on. I mean, it doesn't stop. It's a new beginning. So cancer gives you a new beginning. So I completely agree to that. Just want to have one last question in terms of, so in your opinion, what is the single most, point which you feel is lacking when you talk about cancer care in India? And also, what is the strength which we have for cancer care? So a weakness and a strength.
Okay. So the weakness I would say is that as compared to our Western counterparts, our cases are detected much later, stage 3, stage 4. So although we have robust cancer screening programs, but unfortunately, even if uh, patients have someone diagnosed in the family and we counsel them to get cancer prevention screening test, people don't get it done just for the fear that if I get diagnosed. So I think the main problem with our patients is that they come to us in stage 3, stage 4, when in spite of our best efforts, we are not able to do as much as we could do if they were diagnosed in stage 1. So the most important weakness is lack of a very implementable screening program which can help in diagnosing the cancer patients early. And the strength, as I said, strength is that the government is doing a lot of efforts now, and we have very robust government health schemes through which patients are able to take treatment. And now post-COVID, patients have started taking insurance also. Before COVID, patients were not getting any insurance done. So now majority of the patients that are coming to us, they have either health insurance or some government insurance. So that is why they are getting the best of treatment. And the strength is that I would say that Indian doctors are the most easily approachable doctors. You can talk to them, you can send a message on WhatsApp, they reply to you, they pick up your calls even in the middle of the night, but which is not seen in any other country.
Yeah,
And
exactly.
other places, you have to wait for many, many months even to show for a cold. So I think the availability of Indian doctors, the expertise of Indian doctors, and the compassion and empathy that the Indian doctors have, that I would say is lacking in majority of the places.
I would
So,
completely agree to what you're saying. So, I mean,
and one more weakness, the one point that I want to highlight here is the weakness is that government hospitals are not well equipped. They don't have the latest technology, and the waiting times there is too much long. And the corporate setup or the private setups, they're trying their best. Trust me, honestly, they do try their best. They don't charge as much. They give huge discounts to patients, but still patients don't trust. They still feel that they are being cheated. So which actually decreases our morale. So I would urge everyone to have trust in your team, because see, if a patient lives, then the patient would say, Dr. Indu Bansal is a good doctor. Why would I want any patient to, why would I want to give a wrong treatment to any patient and cause harm to my patient? So the Indian healthcare setup has to be improved in the government sector. The machinery, the technology, those things have to improve. Private sector is doing its best to provide the best of healthcare.
I think very, 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 very well said, Dr. Indu. That's been such a wonderful chat with you. I would like to end by understanding one small aspect from you. After having spent so much time in cancer care, patient care, and caregivers, everything, what is that one single big dream which you have?
Say again, please.
What is that one single dream which you have?
Single dream. Okay.
Yeah, what's your dream?
Okay, so honestly, I mean, for many, although I do a lot of cancer awareness programs or to create awareness as much as possible, my dream is to do something for this, for the underprivileged. I had been thinking of creating an NGO. I did start with something, but then the COVID hit and it did not work out. So I used to do, I started a program, Ask Win Cancer with a Smile. So my dream is to eradicate cancer as much as possible and to bring a smile on every cancer patient. And if I could give my services to more and more patients through some NGO, I would be really feeling very happy about it.
Fantastic. Very good. It's excellent and lovely speaking to you, Dr. Indu. And knowing about you personally, about your poem and about your painting and about your MasterChef experience, besides all those experiences which you shared and the insights which you have given us for cancer care. It's been wonderful talking to you, wonderful having you here. Thank you so much, and really look forward to interacting with you more in the near future. Yeah. Thank you so much, everybody. Thank you so much, everybody. This has been wonderful to have Dr. Indu on board with us for this website chat. And till we meet again for another great personality to share their business insights. Till then, thank you. Adios. Take care.